And so, we've now got things to look for ahead of time, better and better tests that you can see it early, coming in relatively early, and better things to do about it. And some people like to include things like hyperbaric oxygen. I haven't seen great examples of dramatic improvement with hyperbaric, but some people like that. I know actually Dr. Craig Tanio happens to like HBOT and has had good results with, at least with Parkinson's related illness, and potentially with Parkinson's. I don't know about his experience with Parkinson's, classic Parkinson's. So that's another possibility. And then, we talked about glutathione. So anything that's going to help you with detox is going to be very helpful. The other thing that's turned out to be interesting is that one of the big players in helping people who do get better is exercise. And there are whole groups that work basically on just exercise for patients with Parkinson's. So the goal is, let's look at any symptoms coming in early. Let's look at as early diagnosis as possible with things like SIN1 and even if you need to, Fluorodopa uptake has been around for a while. That turns positive about 5 years before you see motor symptoms. So it's another good one to look at. Hopefully that'll be replaced ultimately by these other early tests. And so I think that all these things are going to allow us to see this coming earlier and earlier. So as far as evaluation, let's talk a little bit about what sorts of things you want to look at. Glutathione levels, you have to look at the organic toxins. That's huge. I actually did talk to Dr. Shaw from GPL a few years ago about developing a GPL specifically for Parkinson's related toxins. And the issue is there's a fair number of them. And if you put something together for all of those, it's crazy expensive. So we're not there yet. But I'm hoping that in the next few years, Dr. Shaw and others will be able to develop better and better early tests to look at, what have you been exposed to that could be driving this. Obviously, SIRS-related markers, things like looking at MMP9 and TGF-beta1. Anne mentioned metals. So whatever metals test you like to do, whether you like Quicksilver, whether you like doctor's data, whatever you happen to like. And then, antioxidant related things like vitamin E and D and things like that. And then including ERMI and visual contrast, because again, there's an overlap, of course, with Alzheimer's, but looking at urine mycotoxins, looking at visual contrast sensitivity, looking at ERMI scores or HERTZ-Me2 scores, and then looking at tick-borne problems as well. And then, we've looked into how best to look at your mitochondria. And there are different ways that people have looked at things like muscle biopsies. People do organic acids like pyruvate and lactate. And do you have a favorite way to evaluate your patient's mitochondria currently?
Well, we have on the NutriVal a certain number of, that's probably where I get the most information in terms of mitochondria. Certainly, if you have high toxicity levels, high metals or high toxicity, you're going to be really paying close attention. But the NutriVal will give you a CoQ10 level, a oxidation profile. It will show you DNA damage markers, and so it's very helpful in that regard.
Right. Okay. And then there's overlap. Things like insulin resistance are important in both Alzheimer's and Parkinson's. Homocysteine is another thing to look at. Hormones, another thing to look at.